Med History.
A lightning strike is an electrical injury caused by exposure to a sequential stream of atmospheric electricity discharges. It leads to the development of arrhythmias, neurological disorders, skin burns. Internal organ ruptures, loss of vision or hearing are possible. The clinical picture of the lesion depends on which structure was affected by the traumatic factor. Pathology is diagnosed on the basis of anamnesis and characteristic signs of electric shock, lightning signs. There is no specific treatment. Therapy is prescribed in accordance with the existing disorders. Lightning damage occurs when a person is in the place of its possible formation. Most cases occur during thunderstorms. However, there are situations when a discharge appears from a clear sky. There are fireballs that have the ability to move in the air for a long time and penetrate into people's homes. Among the factors that increase the likelihood of an atmospheric electric shock are being in an open space. It is known that lightning often hits the most elevated areas of the area. Therefore, a natural discharge usually occurs if a person is in a field, on the roof of a high-rise building, or on the surface of a reservoir. Contact with a conductive surface. Lightning damage can occur indirectly if a person holds onto a downpipe, a metal fence, or a telephone wire. A discharge that hits one part of the structure spreads over its entire surface and affects the victim. Staying close to the impact site. When lightning hits the ground, it forms an ascending streamer, that is, it bounces off the surface at various angles. Such discharges are considered relatively low energy, but the current in them still reaches several thousand amperes, and the temperature is 25,000 degrees C. Pathogenesis. The striking factors of lightning include a powerful electric discharge, high temperature, and a shock wave, which is formed when the air is instantly heated to 30,000 degrees Celsius. Under the influence of electricity, first of all, there is a violation of the phases of polarization and repolarization of the myocardium, ischemia of cardiomyocytes, their transition to anaerobic glycolysis. When a current passes through the central nervous system, the permeability of cell membranes changes. There is a denaturation of proteins and a change in the electrolyte balance. Lightning damage leads to the formation of foci of ischemia in the brain, impaired neuromuscular conduction. Massive burns and internal injuries are not always detected in victims. Sometimes there are only lightning signs on the body, symptoms of lightning damage. The symptoms vary depending on the existing injuries. With the development of atrial fibrillation, blood pressure decreases, the victim complains of a feeling of palpitation, and general deterioration of well-being. There may be pain in the heart, mixed shortness of breath. If the conductive pathways are affected, a conduction blockade is formed. The nodes of automation are bradycardia, up to 35, 40 beats per minute. Lightning damage, in which damage to the central nervous system prevails, causes coordination disorders, disorientation in time and space. A number of victims develop a weakening of cognitive abilities after a while, and symptoms of mental retardation are revealed. Sometimes phobias are formed associated with being outdoors during bad weather. Due to the short-term effects of the traumatic factor, burns are usually superficial. Other symptoms are determined by the type and function of the damaged organ. With ruptures of the lung, cyanosis, shortness of breath, hemoptysis are noted. With intestinal injuries, abdominal pain, signs of internal bleeding, a shock reaction may develop. Complications. Lightning damage is accompanied by cardiovascular complications in 46% of cases. Most often, disorders in the work of the heart occur immediately after injury. Ventricular fibrillation or asystole occurs directly at the scene of the accident in some victims, which is accompanied by the onset of clinical death. Severe arrhythmia or myocardial infarction may develop a few days after being exposed to the discharge. Some kind of neurological complications are found in 85% of people hospitalized for high-energy atmospheric electricity shock. As a result of the formation of an ischemic focus in the brain, paresis and paralysis occur, the cognitive abilities of the victim decrease, and vital functions are disrupted. There are known cases of hypertension due to hypertonicity of the sympathetic nervous system. In 5 to 6% of cases, a lightning strike leads to retinopathy and cataracts. This is due to the high sensitivity of the retinal pigment epithelium to thermal and electrical effects. As a result of protein coagulation and impaired nutrition of the lens, the latter becomes cloudy and loses its functional purpose. As a rule, vision is impaired in the eye that was closer to the point of entry of electricity. Lightning damage is divided by the mechanism of occurrence, direct, indirect, reflected, or by the type of electric discharge, linear, ball, step voltage. These types of division make it possible to pre-evaluate the strength and nature of the traumatic effect. The most common classification is considered to be based on the predominant lesion of a particular body system. Lightning strike with damage to the heart. The discharge passing through the coronary tissues disrupts the work of the conducting system. Due to this, the victim develops arrhythmia, coronary artery spasm, and myocardial infarction. If the stroke occurs during the repolarization phase, there is a high probability of ventricular fibrillation or asystole, damage to the central nervous system. The passage of a discharge through nerve structures causes paresis, paralysis, and strokes. In some cases, lightning damage is complicated by vasogenic edema of the brain, hearing or vision impairment of the central type. In the future, the formation of post-traumatic myelopathy is possible. Blunt force trauma. Ruptures of the lung, intestines, and pneumothorax are diagnosed. To exclude such damage, victims of atmospheric electricity shocks should be hospitalized and examined even in the absence of visible damage. Burn injury. The area of burns varies from a few centimeters to 70–100% of the body surface. Patients with massive injuries are usually in a state of shock and need to start appropriate treatment immediately. The mortality rate among the victims with volumetric thermoelectric damage is the highest. In the absence of significant damage to the heart and brain, the prognosis for life is favorable. Severe heart attacks and strokes end fatally in 30–35% of cases. Brain death is accompanied by the emergence of a vegetative state, when the body continues to live with the support of medical equipment, but the brain does not function. Such patients remain viable for a long time, but have no chance of restoring consciousness. Specific preventive measures that completely eliminate the possibility of lightning damage have not been developed. In case of a thunderstorm, it is not recommended to leave the house, use wireless communication methods, hold on to metal objects. It is permissible to leave the shelter no earlier than 30 minutes after the end of the bad weather. When a ball lightning appears, you cannot take drastic actions. Treatment of lightning damage. First aid. If consciousness is preserved, the victim is laid on his back, carefully examined, the damage is covered with a sterile bandage. In the absence of consciousness, a person should lie on his side. Cardiac arrest requires immediate initiation of cardiopulmonary resuscitation. Transportation is carried out by sanitary transport. If necessary, analgesics, sedatives, vasopressors are administered. Conservative treatment. Any electrical injury is treated in a hospital setting. Hospitalization in the intensive care unit is recommended, regardless of the condition of the person who suffered a lightning strike. Here, the intensive care physician has the opportunity to continuously monitor the work of the heart and timely stop complications that are accompanied by electric shock. You may need to consult a surgeon, therapist, or neurologist. Infusion therapy is prescribed to restore the volume of circulating blood and normalize hematocrit. In the presence of arrhythmia, the patient receives antiarrhythmic drugs. If they prove ineffective, an electrical cardioversion is performed. Neurological patients need to take nootropic and vascular drugs, antihypoxants. In addition, symptomatic treatment, anesthesia, and, if necessary, drug sedation are indicated. Surgical treatment. If the victim has internal injuries, they are sutured in the operating room. The intervention is performed in an open or endoscopic manner. The choice of method depends on the prevalence of injury and the technical equipment of the clinic. If WPW syndrome occurs, radiofrequency ablation is indicated. During the operation, electrodes are inserted through the femoral vessels into the heart, with which the surgeon performs cauterization of the arrhythmogenic site. After that, the heart rate is restored.